Hi everyone, Dr. Remy from Pain Free and Fit. Today we're going to answer the age-old question, how to fix lower back pain with bent over rows. Hope you enjoy. So when doing traditional bent over rows and the lower back is more of in a horizontal position and the bar is being pulled towards the chest with the elbows out, there's a good deal of stress that goes into the lower back. People with lower back pain, whether it be from disc, facet problems, stenosis, often have problems and aggravations because of either losing the neutral spine position, which is custom for everyone, while pulling up and increasing the arch, or as the weight is going down, we have a tendency to flex or bend forward from the lower back. So a great traditional exercise can be modified into a more protective lower back exercise by, as opposed to allowing the bar to travel in the air, rather placing it on the thighs and performing a modification known as a bar thigh slide row, where we're pulling the bar up along our thighs. In this variation, you'll notice my upper body is more of an upright position. It's not bent over as horizontal. As a result of this, and the bar on my thighs, there's going to be a lot less pressure on the lower back. My lats are still being used, as well as my posterior deltoid and trapezius and rhomboid muscles as I pull the bar up my thighs, but there's a lot less chance of me losing that neutral spine motion because the weight is literally loaded on my thighs and I'm simply pulling backwards. So it takes out that up and down vertical stress that's on the spine because now my thighs are absorbing that. When performing this motion, there's a couple tips to keep in mind to help with your lower back pain. First of all, if I use a wide stance and I do my row, that's going to produce more stability and help keep me a little bit more upright than if I'm using a more medium or narrow stance. When I use a wider stance, however, my grip will have to be wider as well. With a wider grip, there's going to be more elbow out away from the side of my body. In studies on rowing, this has been shown to put more stress on the deltoid and the trapezius as opposed to the lat. So if your intention is to train the lat muscle, I would suggest a more narrowed stance and a narrowed grip, which allows your elbows now to travel closer in towards the sides of your torso as opposed to away. It's been shown to activate more latissimus action rather than trapezius and upper deltoid action. Finally, by switching the hand position in terms of pronation or supination, palms up grip, may also help with your bent over rows. With a supinated grip with the palms up, it naturally causes your lower back to stay in more of a local arch or extension. This is great for people with disc pain and problems when losing the arch or bending forward aggravates their pain. Versus a pronated grip where the palms are down, this action is more associated with flexion of the lumbar spine. So as we pull, if we have a problem with too much extension with our rows, for instance, as we're rowing, we have a tendency to lift with the chest as opposed to pulling with the arms, that pronated grip is going to help you with this bar thigh slide row to keep the spine from extending too much. Finally, remember to maintain your neutral spine position during this or any exercise to avoid lower back injury. Your neutral spine, remember, is custom for you. It's different for all of us. It's based on how you move and how you position yourself, your postures during the day, the inherent muscle weaknesses and imbalances of your core muscles and how they hold your spine that you've developed over a lifetime. Much of this information can be gained by using a good rehab specialist that's near you, or we've covered this topic here on the channel and other videos. I invite you to check them out, as well as it's covered very much in detail in any of our self-rehab programs for lower back pain available at painfreeandfit.com. I hope this video on fixing low back pain with bent over rows helps you in your training.